Ngn Nclex Actual Exam 2023 Questions Test Bank. Pass with a plus. Real exam questions for your coming exam 2023 to 2024. Question 1. To appropriately monitor therapy and client progress, the nurse should be aware that increased myocardial work and O2 demand will occur with which of the following? A. Positive inotropic therapy. B. Negative chronotropic therapy. C. Increase in balance of myocardial O2 supply and demand. D. Afterload reduction therapy. Correct answer: A. Section. Question set A. Explanation. Explanation. Reference. Explanation. Inotropic therapy will increase contractility, which will increase myocardial O2 demand. B. Decreased heart rate to the point of bradycardia will increase coronary artery filling time. This should be used cautiously because tachycardia may be a compensatory mechanism to increase cardiac output. C. The goal in the care of the ME client with angina is to maintain a balance between myocardial O2 supply and demand. D. Decrease in systemic vascular resistance by drug therapy, such as for nitroglycerin or nitroprusside, or intra-aortic balloon pump therapy, would decrease myocardial work and O2 demand. Question 2. The nurse would need to monitor the serum glucose levels of a client receiving which of the following medications, owing to its effects on glycogenolysis and insulin release? A. Norepinephrine Leveft. B. Dobutamine Dobutrex. C. Propranolol Indrol. D. Epinephrine Adrenaline. Correct answer: D. Section. Question set A. Explanation. Explanation. Reference. Explanation. Norepinephrine's side effects are primarily related to safe, effective care environment and include decreased peripheral perfusion and bradycardia. Bidobutamine's side effects include increased heart rate and blood pressure, ventricular ectopy, nausea, and headache. C. Propranolol's side effects include elevated blood urea nitrogen, serum transaminase, alkaline phosphatase, and lactic dehydrogenase. D. Epinephrine increases serum glucose levels by increasing glycogenolysis and inhibiting insulin release. Prolonged use can elevate serum lactate levels, leading to metabolic acidosis, increased urinary catecholamines, false elevation of blood urea nitrogen, and decreased coagulation time. Question 3. Which of the following medications requires close observation? For bronchospasm in the client with chronic obstructive pulmonary disease or asthma? A. Verapamil Isoptin. B. Amrinone Enacor. C. Epinephrine Adrenaline. D. Propranolol Indrol. Correct answer: D. Section. Question set A. Explanation. Explanation. Reference. Explanation. Verapamil has the respiratory side effect of nasal or chest congestion, dyspnea, shortness of breath (SOB), and wheezing. The amrinone has the effect of increased contractility and dilation of the vascular smooth muscle. It has no noted respiratory side effects. C. Epinephrine has the effect of bronchodilation or beta-beta stimulation. D. Propranolol, esmolol, and labetalol are all beta-blocking agents, which can increase airway resistance and cause bronchospasms. Question 4. The following medications were noted on review of the client's home medication profile. Which of the medications would most likely potentiate or elevate serum digoxin levels? A. KCl, B. Thyroid agents. C. Quinidine. D. Theophylline. Correct answer: C. Section. Question set A. Explanation. Explanation. Reference. Explanation. A hypokalemia can cause digoxin toxicity. Administration of KCl would prevent this. B. Thyroid agents decrease digoxin levels. C. Quinidine increases digoxin levels dramatically. D. Theophylline is not noted to have an effect on digoxin levels. Question 5. In the client with a diagnosis of coronary artery disease, the nurse would anticipate the complication of bradycardia with occlusion of which coronary artery? A. Right coronary artery. B. Left main coronary artery. C. Circumflex coronary artery. D. Left interior descending coronary artery. Correct answer: A. Section. Question set A. Explanation. Explanation. Reference. Explanation. A sinus bradycardia and atrioventricular AV heart block are usually a result of right coronary artery occlusion. The right coronary artery perfuses the sinoatrial and AV nodes in most individuals. B. Occlusion of the left main coronary artery causes bundle branch blocks and premature ventricular contractions. C. Occlusion of the circumflex artery does not cause bradycardia. D. Sinus tachycardia occurs primarily with left anterior descending coronary artery occlusion because this form of occlusion impairs left ventricular function. Question 6. When inspecting a cardiovascular client, the nurse notes that he needs to sit upright to breathe. This behavior is most indicative of A. Pericarditis, B. Anxiety, C. Congestive heart failure, D. Angina. Correct answer, C-section. Question set A. Explanation. Explanation reference. Explanation. A pericarditis can cause dyspnea but primarily causes chest pain. B. Anxiety can cause dyspnea resulting in SOB, yet it is not typically influenced by degree of head elevation. C. The inability to oxygenate well without being upright is most indicative of congestive heart failure due to alveolar drowning. D. Angina causes primarily chest pain. Any SOB associated with angina is not influenced by body position. Question 7. When a client questions the nurse as to the purpose of exercise electrocardiography (ECG) in the diagnosis of cardiovascular disorders, the nurse's response should be based on the fact that the test provides a baseline for further tests. B. The procedure simulates usual daily activity and myocardial performance. C. The client can be monitored while cardiac conditioning and heart toning are done. D. Ischemia can be diagnosed because exercise increases O2 consumption and demand. Correct answer, D section. Question set A. Explanation. Explanation reference. Explanation. The purpose of the study is not to provide a baseline for further tests. B. The test causes an increasing O2 demand beyond that required to perform usual daily activities. C. Monitoring does occur, but the test is not for the purpose of cardiac toning and conditioning. D. Exercise ECG, or stress testing, is designed to evaluate the peripheral and myocardial needs for O2 to evaluate the ability of the myocardium and coronary arteries to meet the additional demands. Question 8. In assessing cardiovascular clients with progression of aortic stenosis, the nurse should be aware that there is typically A. Decreased pulmonary blood flow and cyanosis. B. Increased pressure in the pulmonary veins and pulmonary edema. C. Systemic venous engorgement. D. Increased left ventricular systolic pressures and hypertrophy. Correct answer, D section. Question set A. Explanation. Explanation reference. Explanation. These signs are seen in pulmonic stenosis, or in response to pulmonary congestion and edema in mitral stenosis. B. These signs are seen primarily in mitral stenosis or as a late sign in aortic stenosis after left ventricular failure. C. These signs are seen primarily in right-sided heart valve dysfunction.